Hello, I'm Dr. Trish. I'm one of the doctors at Page Hall Medical Centre, and we're just making a quick video just to show you how to take a COVID swab at home. So this is especially for people who've got a COVID swab from the surgery. Either you've got one extended family or friend to pick it up for you, or we've dropped it off for you. So what you should have is a pack that looks like this. It should have a label with your name on the front, and there's an extra bag on the outside. Inside you should have a packet with a green swab. You should have a bag here like this that you're going to put your swab inside, and you should have an instruction leaflet. So we're just going to take you through the steps on the instruction leaflet one by one. Make sure you wash your hands thoroughly using soap and hot water. Make sure you write the date and time that you're taking the swab onto the label on the bottle in the space provided above the barcode. Okay, I'm now going to blow my nose and then throw the tissue away. Okay, so the next thing I'm going to do is take the swab out of the packet by the stick end. I'm going to use a mirror, open my mouth really wide, and I'm going to roll the swab against the sides of my mouth right at the back near to the tonsils, and it might make you gag when you do this. Okay, so using the same swab, I'm now going to put it an inch into my nose. Okay, so when you put it in, it's important to tip it back a little bit and move it backwards until you can't comfortably move it any further. And then roll it round. Okay, so nearly there. Next bit, take the lid off the green top. Now it's got liquid inside it. It's really important that you don't spill all that, so hold it carefully. Pop the swab into the bottle, and can you see there's a black line here? So it's gonna snap off just at that black line, okay? And then make sure you put the top on really nice and tightly. Okay, so the swab's all done. We just need to make sure, put it into the bag that's got your details on here. Seal the bag tightly at the top. And then if you fold that up, it's then going to go inside the other bag. And seal this again tightly, and then your swab's ready to drop off back at the surgery.